My name is Paul Dwyer. I came to Tomah Memorial Hospital for a double knee replacement. Dr. Brucker was my surgeon.
My name is Jessica. I'm a physical therapist here, and I do mostly orthopedics, outpatient orthopedics. I've been here for 13 years and I love Tomah Memorial. We have everything that we need to help our patients make them better.
26 years we've been in business, my wife and I and family. It's a good way of life. I like it because of the fact that I'm out in the country, I'm by the farms. I'm in my element when I'm on the farm. So I get out of bed about 2 o'clock and I'm on the road by 3 a.m. It's pretty close to a 12-hour day. Wear and tear, getting in and out of the truck and doing mechanic work and different things like that. They got progressively worse and it went from some cartilage to no cartilage, bone on bone. And it got to the point where it was hard for me to walk and a lot of pain.
I'm Dr. Wallace Brucker. I'm an orthopedic surgeon. Among the procedures we pride ourselves in here is total joint replacements. After exhausting all the things that we could short of surgery, Paul and I sat down and discussed the type of surgeries which might be appropriate to him. My partner and I elected to bring Paul into the hospital to do both of his joints simultaneously. We had, I feel, an excellent outcome, and Paul since that time has returned to work fully without limitations, but most importantly without pain, which was interfering with his sleep, hobbies, and activities.
Paul was definitely a very jolly patient. I call him my superstar patient because he was always smiling. Even if he did have pain, even if we were doing some kind of exercise that put him in pain, he'd just breathe through it and just kept on going. First day he came in, it's very rare that we have bilateral both knees done at the same time. They actually do pretty well because they don't have a good leg to stand on, so they're kind of forced to do everything they have to do right away.
As far as I was concerned, the care I got here was second to none. I had good care when I was in the hospital. The physical therapist that came up to the room the first day, and she told me what I was going to do, what to expect, what not to expect. Then I started coming down to the physical therapy room down into the rehabilitation center. I think if you hurt bad enough, the pain you have after the surgery is nothing because you have such relief from the joint. It was great for me because I never had a day really of pain other than the swelling that was in my legs from the surgery. So I was totally amazed that I could walk as good as I could right away. You have the surgery here, you have your rehabilitation here, you have your surgeon that did the surgery here if there's any questions. Right here in our own community, you don't have to drive 40 miles or 100 miles. We were 5 miles from here. The surgery went well and I can do things that I hadn't done in 15 years.
Tomah Memorial Hospital, taking care.